Welcome to How to Talk to Kids About Anything with Dr. Robyn Silverman, a podcast loaded with practical tips, powerful scripts, personal stories, and simple steps to make even the toughest conversations easier. So get ready to get the information you need to make the impact you want from someone you trust, your friend, parenting expert, Dr. Robyn Silverman.
Hello and welcome to How to Talk to Kids About Anything, where we give you the tips, scripts, stories, and steps to make even the toughest conversations easier. I'm so thrilled to be your host, Dr. Robyn Silverman, child and teen development specialist, author, and speaker, and most importantly, parent of two great kids who give me the opportunity to love, learn, and grow every single day, whether I want to or not. Believe me, I get it. It's not always easy, but we're in this together, and thankfully we have a lot of wonderful people we can call on to get the help and insight we need. So good hygiene, whether it's bathroom hygiene, hand and nail, foot hygiene, oral hygiene, bathing hygiene, hair hygiene, it all keeps us clean and healthy. When our children are babies and toddlers, we take care of everything from clipping nails to bathing their bodies to toiletry and clean clothes. But as our children get older, we start to step back and we allow our children to take charge. Now, I'm not saying this always goes smoothly. Sometimes kids fight their parents on taking a shower, or others let their toenails grow so much that they get holes in their socks. And we all know of those kids who just take any old clothes off the floor and wear them once again if it passes what they would call the sniff test. At least, well, it's not that bad. Now, is this a big deal? Sometimes it is. So we've got to talk to our kids about hygiene so that we understand why keeping clean is so important to our health and how we feel. Now, we're so excited to welcome back my next guest to the show, Dr. Wendy Sue Swanson, who you might remember from our show on food allergies. Bridging the digital divide between doctors and patients, Dr. Swanson, who is the Chief of Digital Innovation at Seattle Children's Hospital, has blazed a trail of patient education using her voice through a variety of different channels in traditional and social media. Through her blog, her podcast, and social media channels, and her parenting book, she translates science and parenting information to the public. Swanson also regularly partners with reporters in traditional print, online, and television media and makes weekly TV appearances in Seattle with the NBC affiliate King 5 News. Now, she hopes to transform this approach of pushing people away, maybe not including the parents, maybe not including the people that are coming to her, and making sure that patients are really understanding the science, that they feel empowered, and that we are learning from our peers and getting the expert advice online that we need to make sure that our families are healthy. Now, you've already heard her talk about food allergies, and now we are moving on to this discussion of hygiene, so let's jump right in and welcome you once again, Dr. Wendy Sue Swanson, to How to Talk to Kids About Anything.
Thank you. Thanks for having me.
So before we leap in, I'd love to get a take on why you became so interested in good hygiene and kids.
Well, it comes by just, having kids around. Like, it's kind of a disaster in life. No. But also there is, you learn the hard way, but you also learn, for me in pediatrics, like hygiene actually is not all, perfect hygiene in the standard way that I think our grandmothers and mothers thought about it may not even be of great benefit. So talking about how do we live with bacteria in smart ways, and how do we get rid of the bacteria that we don't want? And then how, do we even take care of kids amid different things like flu season, right? Like, what is it that we're doing with hand washing? How are we sneezing and coughing? How are we staying home? How are we moving around in this world where we live with fungus and virus and bacteria and dirt, and that some of that dirt's good and some of it isn't. Mm-hmm. So figuring out kind of how do we raise kids in that way. And I love, one of the topics I really want oral health, because the mouth is one of our dirtiest parts of the body when it comes from a bacteria standpoint. But how we care from the very beginning, from our baby's mouth to our own mouth, as we rear and kind of grow our kids in the same environment, really does change and set up them for different risks of disease and long-standing problems.
All right, so let's start there. Let's start with there. So if we're talking about oral hygiene, at what age should you start brushing a child's teeth?
Well, no question, the very first day you see a tooth, that tooth pops in usually somewhere between, on average, it's about 6 months of age. Some kids will pop a lower called a central incisor, those center teeth on the lower jaw, as early as 4 months. But really, as most moms know, most babies get them somewhere between 6 and 12 months. It's really hereditary when you get your teeth. So when mom and dad got their teeth tends to be a bit predictive, and when siblings do. But the minute you get that tooth popped through is the minute you begin brushing your children's teeth every single day. And believe it or not, and I think a lot of families are still catching up, also want you to have fluoridated toothpaste from day one. So we don't want you to wait to put fluoride in the toothpaste until they're 3 years of age. We just want you to use a very little amount, and we use it at the right times in the right ways, which I'll go over. But right from the beginning, you're brushing that baby's teeth. First time you see that pearly white pop through the gum line, we want that to be cleaned every day after the last feeding, and ideally another time in the morning time.
Oh, okay. So I'm curious then about what we're supposed to do as time goes. Now, we have to kind of begin to let go. We're not the ones who are constantly going to be brushing our child's teeth as they grow. So how do we let go? How do we ensure that our children are brushing their teeth well? And when is the time to sort of say, okay, you're the one who's brushing your teeth and taking the lead?
Well, yeah. So first and foremost, of course, your baby and toddler and your young child, you are the one doing it, right? Because kids are, drama kings and queens in the toddler years and preschool years, and you just got to kind of, force your way through it. Now, lots of new toothbrushes with the electric models and the kind of vibrating toothbrushes have little timers on them and rewards, and there's even an app for some of the toothbrushes out there that help keep kids engaged with little characters and things. But about, I usually say I want a parent to be guiding and supporting and modeling. So either brushing their teeth at the same time as their child in the preschool years and school age years at night together until a child's about age, basically 7 or 8, grade 2. So I always have this rule of 2s, I think helps us remember. In an ideal world, you want your kids to be brushing their teeth for about 2 minutes so they can get to every surface of the gum line and every part of the teeth. You want them to brush 2 times a day, and you want them to get your help until they're at least at 2nd grade. But I don't know. I have a 3rd grader and a 5th grader, and they still need nudging and reminding and prodding.
Yeah,
right?
I actually wanted to ask you exactly that, because what if it becomes a little bit of a fight, or you find out that your child's sort of skimping? Like, what is it that we do in that scenario?
Well, a couple things. Pediatric dentists, again, want you to use the fluoridated toothpaste from the very beginning. They don't want you to rinse with water thereafter. So let's say you got a skimper toothbrusher, which I have one of those in my house.
I do too.
I also have a kid who is dishonest about it. Like, I'll be like, did you brush your teeth? And he'll say, yeah. And then I'll smell his mouth. I was like, give me a break.
Yeah, I feel the toothbrush. I'm like, this is not even wet.
Yeah.
I don't understand.
Yeah, it's not wet. Yeah, no, totally. It's pathetic, right? But
what is the problem here?
But yeah, no, right. No, but because it's just annoying, right? They don't see the value. They don't understand. But that, we know the most common chronic disease of childhood is, dental decay. The bacteria that live in your mouth are passed on from people in your life. So, for example, one of the reasons we want pregnant moms to see the dentist regularly, and particularly after a baby is born, is because we kiss our babies. Of course we do. Like, they're delicious.
Yes.
And, when we're kissing our baby, we are transferring the bacteria from our mouths into theirs. So if you don't have good bacterial control and you're not brushing your teeth well, and you've got aggressive bacteria that are attacking that enamel, you're passing it on to your babies into their mouths, and then it starts to live there. So again, it's this whole family model of understanding that dental hygiene and dental decay comes from aggressive bacteria that aren't cleared there. And so a couple points, brushing your teeth, right, in an ideal world is 2 minutes, 2 times a day, fluoridated toothpaste from the beginning. With babies, we want just a little rice kernel amount. So not a lot of toothpaste on that baby or that toddler's toothbrush. Just think of like a tiny little dried up rice kernel. That's the amount of toothbrush you smear all over the toothbrush so that they're not taking in too much fluoride and swallowing it. Once your baby can spit, like, 3-year-olds, most 3-year-olds can spit, 3 and 4-year-olds. Once they're spitting, then I'd say a pea-sized amount. And that's all you need. You do not need a lot more than that. But one of the things you can do for them skimpers is know the data that ultimately, once that fluoride is on those teeth and they get it around their mouth, you can either do a fluoridated mouth rinse and then no rinsing with water, or just make sure they spit out that last, wad of toothpaste and foamy stuff in their mouth, and then they don't take water. Because you're leaving some fluoride on those teeth when they go to sleep at night. And same thing for babies. If you're breastfeeding your baby and thing, what in ideal world you really want to do once they have teeth is not go right from breast into bed, but then brush the teeth and then lay your baby on their back to sleep at night. That interrupting that right from a bottle or right from breast to sleep, because that, breast milk and formula are full of sugar.
Yes.
And those sugars are natural good sugars, but those sugars really will coat the teeth and will lead to increased rates of dental decay over time. So with the skimpers, do your best, prod them along, create reward systems and brush with them, all the little antics that we do as part of the bedtime routine and morning routine. But, one quick thing on that is that not rinsing with water will keep some of that fluoride on the teeth. And then seeing your dentist every 6 months. And that's from the very beginning. It used to be that family dentists and pediatric dentists said, okay, well, just brush your use tap water because it's got fluoride in it. Don't use only bottled water with your kids, and then see us at 3. No longer the case. I mean, pediatric dentists and the American Academy of Pediatric Dentistry says see your pediatric dental provider at the first tooth eruption and then every 6 months thereafter. So that includes when your kid is just getting all those teeth through the toddler years. You do want to see the dentist every 6 months for good cleaning, and often they'll do a fluoride varnish. And some pediatricians around the country, here in Washington State, we've been trained across the state that we do fluoride varnishes as well to really prevent decay over time.
Yes, I know. I love that. I was like, I wish I had that when I was little, because I tell my kids straight out that I had cavities when I was, 7th, 8th grade, that kind of thing. And I certainly don't want them going down the same path. I have, we're flossing. We did not do that type of stuff when we were younger. I remember back when the nurse would come to our classroom and she would teach us about oral hygiene. There was these like red pills or something we would chew, and they would get all over our teeth so that we could see what we were supposed to brush. Now it's, they're talking a lot more about flossing, and, we're going in the right direction.
Yeah, the data on flossing, it's funny. I mean, flossing, most pediatric dentists will say, well, you can tell kids, about 4 out of 10 parts of the gunk in your mouth, or 40% you get with flossing that you'll miss with just a standard toothbrush.
Ooh,
and then
I like that.
The last thing I want to say, it's true. But the last thing I want to say too is smart snacking. One of the things I learned as I started partnering with more pediatric dentists is ultimately that after each bite that you take, so even like a sip of a latte, so this is for moms too. A sip of a latte is full of milk, right? Yeah. And for 20 minutes after that sip of a latte, you have acidic change in your mouth that make the bacteria that eat and chew at your enamel active and change. After 20 minutes, the spit around your mouth kind of washes over your teeth and clears it. But if you snack like a toddler, or you sip a latte like I do all morning long, it's actually really bad for our teeth. So smart snacking of nuts and cheese and things, but not fruit leathers or fruit roll-ups, and not even like goldfish crackers and crackers that stick and adhere to the teeth, or like a bagel. That stuff really does lead to more and more decay. So, a sippy cup full of juice, the reason pediatricians and dentists hate it is that it's just a really high sugar load. And kids sip it, and then for 20 minutes after, all those bacteria are chewing at that enamel, and then they take another sip 20 minutes after, chewing at the enamel. So if you're going to give your kid a cup of juice, do it, but just do it in one sitting. And take it away.
I call it liquid candy. It's like just sitting on your teeth, but I totally agree. Yeah. So at this time of year when everybody's getting sick, so that's what's happening. That's all we hear about now.
Well, we're having a big flu season.
Oh, it's terrible. Yeah, it's terrible.
Everyone is sick and with significant illnesses. Yeah.
Yes. So we know hand washing can be a saving grace. We've heard that from the beginning of time, it feels like. So what are some hand washing tips and tricks that we can teach our kids? I like to tell my kids, like, don't stick your fingers in your mouth, your nose, your eyes, your ears. But, we also need to wash our hands. So what can we do to get them to wash their hands well and really help to prevent some of this illness?
Yeah, well, first and foremost, it's really tough, right? Kids don't like to do it, and they do it inefficiently. So hand sanitizer has been this awesome crutch that we have, which I love, right? It's easy when you're on the go. We want kids to wash before they eat, right? Because some illnesses are transmitted from what's called fecal oral, or just basically oral transmission. So, when you've got the stomach bug going around a daycare or going around a school, it's contaminated surfaces that people touch, and then they touch their mouth and they get it. So, however you want to get. It's little teeny fecal contamination that'll get into the mouth. So always washing hands before eating is just a standard rule. If you do it at home yourself before food preparation, and you do it at home with your kids before any meal, it will become more and more of a habit. It's one that I think is probably one of our best. Of course, after the bathroom, good grief, that is hard with kids.
Oh my gosh, they run out of there. Right? They barely turn off the light. What is the deal with that? They
run out of there. Well, my kids don't even flush the toilets, of God's sake.
Oh my goodness. It's like a reminder. Every parent knows that's
disgusting. And I'm raising 2 boys.
Yes.
Yeah. So, but of course, before and after the bathroom, the bathroom for sure, and then before eating. Yes. And then like this time of year, it's really thinking on, okay, of course it's hand washing, but it's also thinking about infection control of like, well, what do we do with our hands? We know we touch our faces constantly, so we know if we've got a runny nose.
How about that one? That would be good.
Yeah, well, that's a really hard one, yeah. Because that's a nervous habit that's really almost, at a different level of consciousness that kids are doing that. But I think, ultimately, when they're coming from outside, right, transition. I mean, think about it as transitions in life: before eating, after the bathroom, after you've been playing with a pet, after you've been outside, that those kind of hand washings are there. But then thinking about, okay, well, this time of year, we know that the reason that influenza is spiking right now is it's getting spread around. The reason it's getting spread around is we're in close quarters more. We're not as outside as much. The windows are open. Our houses are closed. And you cough and it goes into the droplets, or you wipe your nose and you touch a counter and somebody touches the counter and then they touch their nose and they've given themselves the viral material that kind of causes infection. Right. So it is really teaching kids that keeping their hands clean is really important. And that includes, like, if you're coughing or sneezing, you're doing it in your elbow. And honestly, ensuring that your kids do that, covering their cough from the very beginning, and doing it yourself where you're using your elbow, not your hands. You're just more likely not to then contaminate surfaces and contaminate other people.
So you're not touching things with your elbow.
Yeah. And then just two other reminders I'd say, it's like, right. And then two other reminders I'd say is the, washing long enough. So, kids will put their hands under the water really quickly. It's actually the act of physical, the hands going back and forth, that friction, that tends to be more effective even than the soap itself. So it's the act for at least 15 seconds of going back and forth. And then a note on soap, we don't want you to use antibacterial soap. There's no that it improves the health of your family or the health of the population. Right. And they've been FDA basically regulated to get the ingredients that uses the claim for antibacterial out of products that are sold over the counter. So don't think that you have a lot of added protection from antibacterial. It's really the act of friction and water and 15 seconds. So even if you're in a place, let's say you're at a park and there's no soap left in the container, don't forego going under the water. Going under the water and washing those hands, even without soap, is still worth the effort.
Oh, I like this. My daughter says you're supposed to sing happy birthday while you wash your hands.
I know.
Yeah, well.
That's like the 26-second thing.
Yeah.
Yeah, I don't know. We did that for a while. It never worked. So good luck. I love the adage. It's never worked for my family to sing happy birthday all around the clock. Nobody does it. So I don't know. I can't get them to do it. Yes. So now I'm just more focused on, count to 30. You count to 20.
Yeah, could you rub your hands together at least 5 times?
And then teaching kids the line.
Okay.
Yeah.
Yes.
Better than nothing.
Yeah, yes, better than nothing. So you know what else is rampant? And this has been going around in my child's classroom like crazy cakes right now, is head lice. It's just permeating my daughter's grade right now, it feels like. And it's one contagious situation. So is head lice a health hazard, a sign of poor hygiene? Is there something we can do to prevent it? What can we do about it? What's your take on that?
Okay, first and foremost, head lice is disgusting, right?
It's disgusting.
All of us
there's bugs crawling out in your hair.
The note
it's sad.
From school, you get the note and you brace yourself.
I know.
Oh God, here we go again. And my son once had it repeatedly when he was in preschool, over and over again, because he kept getting reinfested.
It's just it's just yuck. No, you don't want that.
So number one, it's not a hygiene thing. So I can't say it loudly enough. I mean, this is not because somebody did keep their house clean, not because somebody didn't keep their kid clean, not because somebody didn't keep a classroom clean. And it is also not a health hazard. It's just a yucky inconvenience. And that has moved even the American Academy of Pediatrics, in the last decade to make guidelines to say, those nurses who knit checks and who look at kids and do lice checks, nobody's needs to go home from school anymore, because it's true. It's not, we don't want kids to have absenteeism because of little bugs crawling around their scalp, even though it's gross and kind of unsettling. It isn't dangerous for a child. It's just
interesting,
yucky, right? So, number one, a couple of things. The over there generally work very well. And, they work in different ways, but most of them are basically what are called neurotoxic. They basically paralyze the lice itself. They kill the lice from living. And they often will be what's called ovicidal, where they kill the eggs as well. You put them in your kid's hair, you take them out. You often will repeat them in 7 to 10 days after, and you're kind of done with it. Lice only live about 24 hours after not being on the scalp. They have to be in a warm environment to survive, and they need some sort of blood supply. So the good news is too, I get that icky feeling about my house once my kid has had lice. Well, you wash everything in hot, and you go vacuum if you want, and you make sure you throw the brushes in the dishwasher or throw them in the freezer overnight. But ultimately, your house is not contaminated for a lifetime here. I mean, after 24 hours that a lice is not sitting on a scalp, it's a goner. I mean, it just can't survive, and the eggs are the same way. So you don't have to go completely banana brains, once your child has had lice and you've eradicated it. But the one thing to also know about is there are some resistant strains, and there have been some studies, and I a bug recently about this data, but ultimately in 2016, they surveyed 48 of the states and different bugs from all over the country. And every state had some degree of resistant bugs, meaning that some of these bugs have genetically changed to resist some of the typical and most common ingredient is an ingredient called permethrin that's like in something like Nix or Rid. And so there are some prescription medicines that can vary in one-time treatment, get rid of lice as well. So, most of the time when kids have repeated infections, it's because they're going back to school and they're getting reinfested, that lice is crawling from one kid's head to another kid's head. It's not as common that they go through hairbrushes or hats or costumes or clothes. It really is kids playing in close contact and like the bug jumping from one scalp to another. But if your kid gets it a second time and then you're just pretty sure they're not getting reinfested, then go to the pediatrician or family doc and ask them, because there are some prescription medicines that might be a little bit expensive, which is why we don't always use them. But there are some resistant strains across the country too. So talking to your pediatrician, even if your kid gets it the first time, you could make a quick phone call and say, hey, are you seeing a lot of resistant strains in our community? So should we just go right to the prescription, or do you think I can use the over-the-counter?
Okay, so the over-the-counter is the answer from the beginning. What about I've seen, the things that you can use to spray on your kid or, on their hair, shampoos that are sort of preventative. Do those work?
Yeah, we had those. Those come from the community of folks who don't want to use these kind of neurotoxic chemicals, and that's fine. If you're a family who's saying, these are approved by the FDA, these are safe to use, particularly for one time, and particularly in kids over the age of 6 months, one time, I'm not that concerned about their safety. But if you really want to have an approach where you're saying, I don't want to use a medicine that kills the nervous system with this bug on my kid, fine. There are some that are kind of suffocating agents. And then there are these lice combing places. So I did take my kid to one of these lice combing places where they use oil basically to suffocate the lice, and then they comb and comb and comb and comb. And then you go back a week later and they comb and comb and comb again. And you can do it. They're just a little bit expensive. And then they'll do these preventative sprays and things. I don't think there's a lot of data that you can spray your kid with this weird smelling stuff and the bug's not going to crawl into
hair.
It's
like citronella. It smells like citronella.
Yeah. I just don't think that's a great strategy, to be frank. I think it's kind of getting involved in your school when there is an outbreak and making sure that they're kind of cleaning up and vacuuming at the end of the day, that they're having everybody in the school check their kids and they're really looking behind the ears. The most common place to find these little guys is like behind the ear and the lower hairline, and making sure you're really doing a good check. It's hard to check for nits. Nits are the casings,
they look like
from the lice and eggs on the shaft.
Yes.
Yeah, and they look like dandruff, and it could be. So it's hard to do that. And so it's really, having and arming parents with good kind of checks in that way, and then either doing a really good mechanical comb out, and then also doing treatment and following the guidelines, where if the bottle for the over-the-counter medicine says treat, and then treat in 7 to 10 days, you got to do the 7 to 10 days.
Okay.
And in the meantime, not going bananas, but still, washing all the clothes and hot water and vacuuming around where your children play.
So if it occurs, don't panic. Do what you need to do. Get rid of it. Keep checking, and hopefully make sure that we don't reinfest ourselselves, because we're going to clean everything. But really, you can't do everything about it. But you can say to your child, "Let's not hug our friends right now in class because it's going around your class. Let's try not to share the hats and the hairbrushes, and maybe we can play without putting our heads together so much."
Yeah, good luck. But yes, I think we can tell our kids these things, and then I think it goes in one ear and out the other.
I know, that's why it keeps occurring.
Robyn, the last reminder is, again, if you're having a hard time getting it might be worth a quick phone call or a visit to the pediatrician too, because some of these resistant strains are out there, and sometimes a prescription med may do the trick. But typically, the usual first approach is just kind of getting rid of it and doing the aggressive combing and using the over-the-counters. And then, to your point, doing your best to contain it.
So before we get to your final crucial tip, I read somewhere that you're supposed to be having your kids shower twice a day. What is your advice on how often a child should bathe or shower?
What?
I know. I couldn't believe it when I read that. Who even has the time?
Yeah, no way. One of the things I think we do is, in this kind of hygiene engineered society, is we might actually bathe some of our kids, babies, too much.
I think so.
Little babies, the nice oil on their skin. They've got gorgeous skin. And sometimes we love the bathing routine because it's a ritual for infants. But I'd say, most kids probably only need to be bathed every 4 to 7 or 10 days. Mm-hmm. Now, older kids, certainly school-age kids, we bathe them because they get grubby and they play with each other and they're sweaty and they're dirty because they're exploring the planet. But twice a day bathing,
Isn't that crazy?
I've never heard the advice, nor could I recommend it from a kind of the integrity of your skin. I mean, I think you'll ultimately dry out the skin and the barrier that is the skin of the largest organ in our body. So that's not coming from me.
No, thank goodness. I've read it several times because I was so shocked about it. And I was like,
my boys certainly aren't showering twice a day. Let me tell you, that would be like an epic feud in the house every day. So I think as these kids get towards the tween age, you get into these battles of even getting a shower in every couple of days. But I think with athletics and playground and exposures, we love to have our kids bathe, every couple days.
Yes.
But again, bathing tends to be stripping of the natural oils that are there, and that's part of the barrier in the skin. So it can be drying, and kids with underlying skin conditions like eczema and other conditions, you'll exacerbate that sometimes too. So nope, I'd say every couple days at maximum. Once teens are going through puberty and, those changes come, most teens, either are resistant to and or want to bathe every day because of hygiene and their desire to actually appear all put together,
and maybe smell good too in the process.
And smell good too. I know, wouldn't that be nice? Yeah.
So, what is your top crucial tip when it comes to hygiene?
Well, I think number one, dirt is generally not dangerous, nor are lice, right? But that ultimately, the place that you want to think about really keeping very clean is the mouth. That's probably the number one place you should focus and target in your life. And that's right from the very first tooth eruption, using fluoridated toothpaste every single day on your babies and kids all the way through, and taking care of your own mouth so that you're not transferring dangerous, dirty bugs to your baby when you're kissing them. And then otherwise, it's really managing during infection times, keeping our hands washed, and learning to cough and sneeze in smart ways like our elbows.
If we want to get some more information about you and all the things that you do, where can we go to get that information?
Thank you for asking. I'm Seattle Mama Doc, MAMADOC. So I'm on Twitter as Seattle Mama Doc. I'm on Facebook and Instagram. I'm Mama Doc Med on Instagram. And my blog, Seattle Mama Doc, is at the Seattle Children's webpage that I've been writing for 9 years. So over like 800 blog posts on all things hygiene, oral health, allergies, vaccines, parenting choices, and my own challenges with work-life balance.
Well, thank you so much for all of that great information. These are all the things that we probably have in our heads but don't know who to ask. So thank you so much for coming on the show and talking to us about good hygiene today.
You're welcome. Thanks for having me.
Well, thank you. And I've got my takeaways, and sweet friends, I know you have yours. Let's discuss them. Come up on Facebook, go to the Dr. Robyn Silverman page. Let's chat about it at drrobynsilverman.com or twitter.com/Dr. Robyn. I'm on Instagram. I'm going to be putting memes up from Dr. Swanson right there on Instagram that you can share. And I'm under Dr. Robyn Silverman. Love to have you up there. And if you'll go up to iTunes and rate and review this podcast, more people will learn about Dr. Swanson and all of these great tips. I'd love you to do that. I'd really appreciate it. That's all the time we have for today, my fellow parents, leaders, and educators. Thank you so much for tuning in to How to Talk to Kids About Anything. For more information on books, articles, speaking engagements, or curriculum, please visit drrobynsilverman.com. So many great podcasts up there, great show notes as well. And I look forward to weathering the storms and enjoying the sunny side of life together. And please remember, even on the days when we fall short, you've got this. You're here, you're getting the information you need. I know it's not easy, but never forget there's always tomorrow. Parenting is the ultimate do-over. I see you, I'm right there with you. And as there are moments when we doubt our know-how, our choices, and our sweet sanity, please know you are 10 times the parent you think you are. You really are. Until next time, this is Dr. Robyn Silverman with How to Talk to Kids About Anything. Please tune in again and keep connecting through conversation. See you next week.
You've been listening to How to Talk to Kids About Anything with Dr. Robyn Silverman. For more information on books, articles, speaking engagements, or curriculum, please visit drrobynsilverman.com.